to make ABG interpretation easy. With this method, we'll be able to identify whether someone is in respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. ROME stands for respiratory opposite metabolic equal. Remember this for future reference. A quick refresher, pH of the body is normally 7.35 to 7.45. PCO2, the partial pressure of CO2, reflects the amount of carbon dioxide gas dissolved in the blood and is usually between 3.5 and 4.5. And bicarbonate levels is typically between 22 and 26. In physiological terms, anything below a pH of 7.35 we consider acidotic. Above 7.45 we consider alkalotic. When looking at PCO2, below 3.5 we tend to think alkalosis, and above 4.5 we tend to think the patient is a little acidotic. For bicarbonate, if this level is below 22, we consider them acidotic. Greater than 26, alkalotic. Now, respiratory opposite metabolic equal. How do we use this? We want to compare two levels, PCO2 and pH. And in the following examples, the yellow arrows will determine if the arrows are moving in opposite directions, indicating a respiratory issue, or in equal directions, indicating a metabolic issue. So, in this first example, the pH is 7.21, acidic, lower than normal, so we can consider that down. Remember, normal PCO2 is between 3.5 and 4.5, so a PCO2 of 2.4 is also down. Both arrows are moving equally and in a downward direction and in the same direction. Going back to our ROME method, metabolic equal, we know whatever the condition is, this is likely a metabolic derangement. And looking at the pH of 7.21, we know this is acidotic. Thus, the disorder is metabolic acidosis. Another example, pH is 7.23, PCO2 is 6.2. In this case, the pH is down, PCO2 is up, so these arrows are moving in opposite directions. Going back to the ROME method, respiratory opposite, we know this is a respiratory issue. And looking at the pH of 7.23, that's acidosis. So this is a respiratory acidosis. pH here is 7.51, PCO2 is 6.3. The pH is up, the PCO2 is also up, both moving in an equal direction. According to the ROME method, that's metabolic equal, and a pH of 7.51 indicating alkalosis, this is clearly a metabolic alkalosis. Here, pH is 7.61, which is up. PCO2 is 1.9, which is down. Here, the arrows are moving in opposite directions. Finally, back to the ROME method, respiratory opposite. I know this is a respiratory issue. With a pH of 7.61, I also know it's alkalotic. I hope that explains how to use the ROME method to quickly interpret an ABG. Any questions, please email or comment below. Please stay tuned for the next ABG video, which will cover ABG analysis and interpretation in greater detail.